Good morning, everyone. This is Jess Bajimola, your nurse leader, and I'm going to present the challenges, root cause analysis, planning, intervention, evaluation, and the next steps regarding improving documentation compliance of social determinants of health in the electronic health record by the 7 West PCU of UCSD Health. Please pay close attention to the details and learn from our experience and the possibility of this performance improvement project for our institution to adopt, as it is mandated and will be reported to the Centers for Medicare and Medicaid Services, which will have an impact on the reimbursement of our services. Thus, we lay the foundation and strategies for compliance, a measure of being a high reliability organization. UC San Diego Health is deeply committed to providing exceptional patient care and positively impacting the community through cutting edge research and inspiring education. They are dedicated to advancing science and medicine, finding diseases for its cure, and shaping healthcare's future through research and innovation, health equity initiatives, education, and community engagement. Their efforts aim to translate scientific discoveries into tangible health improvements and ensure equal access to health opportunities for everyone. A comprehensive needs assessment was conducted to identify the need for this project. This included surveys of healthcare providers, data analysis of current documentation practices, and interviews with key stakeholders. The findings revealed significant gaps in SDOH documentation, highlighting the need for standardized and comprehensive documentation practices. A 2 month data gathering of the compliance and the documentation of the five domains of the SDOH revealed that there is a gap. In June 2024, out of 30 admissions and discharges, 11 still needed to be completed, and 19 were completed, which is only a 58% compliance rate. In July, 21 had yet to be completed, and 24 were completed, with a 42% compliance rate. Aside from that, there were informal interviews with social workers, case managers, and some of the staff to get their take on compliance and identified barriers. The project focused on improving SDOH compliance documentation in the electronic health record. This topic is crucial as it directly impacts patient outcomes and supports population health management by providing a complete picture of patient health and social needs regarding food insecurity, utility difficulties, housing instability, and interpersonal safety. Again, holistic care and total quality patient care and safety will be the vital elements that promote health justice, equity, diversity, and inclusion. For the month of June and July, there is an opportunity to increase the documentation compliance of SDOH. SDOH questions were added to the inpatient admission database as required documentation in January 2024. The background or overview of the SDOH is a critical cornerstone toward a healthier future that will provide clinicians with information to help intervene with patients at risk of adverse health outcomes. Five SDOH domains are currently in the PADB: food insecurity, housing instability, transportation needs, utility difficulties, and interpersonal safety, including intimate partner violence. Furthermore, the physical environment and availability of resources at the community level significantly influence overall health. Broader societal factors, including policies and laws at the societal policy level, powerfully shape the overall health landscape and contribute to health equity and disparities. The project aimed to achieve higher compliance rates for SDOH documentation, improve patient outcomes, and better support for population health initiatives. If not implemented, the anticipated outcomes included raising awareness about the importance of SDOH documentation and initiating initial improvements in documentation practices. Improving compliance documentation of social determinants of health in the electronic health record is crucial for enhancing patient outcomes and effective population health management. Let's delve into why this topic is essential. Impact of SDOH on health outcomes, which encompasses environmental and socioeconomic factors such as housing, education, employment, and access to food. These factors significantly influence access to quality care and are critical for patients' health and well-being. While medical care accounts for approximately 20% of healthcare, SDOH, including physical, environment, socio-economic factors, and health-related behaviors, accounts for about 80% of outcomes. Integration of into EHRs, integrating SDOH data into the EHRs can dramatically increase the scope, quality, and timeliness of data used to plan interventions targeted at SDOH factors. By capturing essential SDOH information such as housing, transportation, and diet in real time, clinicians can make more informed, targeted medical decisions that deliver higher quality care. Patient-centered care. So for clinicians, capitalizing on SDOH data requires access to information on housing, education, employment, and food. Incorporating SDOH data into EHR supports personalized care decisions, allowing clinicians to identify non-compliant patients with their medical regimen due to SDOH circumstances beyond their control. Evidence from a research by Potrel and his team in 2021 systematically reviewed NLP approaches for extracting SOH data from unstructured clinical text in EHRs. They emphasized the potential of NLP to aid in developing screening tools, risk prediction models, and clinical decision support systems. Another study by Shen and his team highlighted that integrating individual level SDOH into the EHRs improves predictive outcomes such as service referrals, medication adherence, and risk of readmission. We conducted a pre and post survey on knowledge assessment on the social determinants of health. Table 2 refers to the institution's project initiation. The staff felt limited time for prompting, introduction, and training. The same is true for Table 3. Table 4 shows that there was an increase in knowledge after several interventions such as training of super users, writing commitment paper to follow the mandate by the CMS, presentation during huddles and the UBPC and staff meeting, and the creation of posters and binders to introduce and explain about the rationale, compliance on the documentation of the SDOH. There was an upward trend in the increase in knowledge as seen and correlated in this chart. Table 5 shows that it is the primary responsibility of a nurse, whether it is the primary nurse, resource nurse, charge nurse, or case manager, to document and comply, and they have included a social worker too and a small group of clinical care partners. In the hospital setting, it is the primary nurse, the resource nurse, and charge nurse whose primary responsibility is to complete the SDOH assessment. But as we move on, there was a change that impacted the result of the September documentation compliance because of a new rule which will be discussed later. Table 6, as per the mandate of the Center for Medical and Medicaid Services, or the CMS, SDOH completion can be done during the first encounter, while in the hospital, before discharge, and every time the patient gets admitted, but this shall be another opportunity for discussion. In the outpatient clinics, the SDOH was also reported or started and can be validated again during a hospital encounter. Table 7 shows that the majority know that the SDOH completion can be directed by checking the PADB and required documentation. The number of respondents increased to 91% out of a total population of 34. Table 8 indicated that the comfort level in asking about the SDOH increased by 43%, while there was a decrease or shift from not being comfortable to somewhat comfortable and comfortable. Table 9 shows that the majority of the staff pointed out and identified that more than 99% were aware before and after the survey of the various social determinants of health. Interpersonal safety and intimate partner violence were missed at as the fifth option. Table 10 revealed that the staff identified barriers with a median score of 22.98 during the pre-assessment survey and 36.6% after the post-assessment survey. There has been a 61% increase in clearly identifiable barriers to SDOH documentation compliance. Table 11 shows that most responses about trending and tracking SDOH outcomes include improving health and reducing long-standing disparities in health and healthcare, identifying risk factors that impact mortality rates, morbidity, and overall life expectancy leads to better health outcomes, and allocating resources, reducing healthcare costs, and providing insights into patients' health status and functional limitations for targeted interventions. Consistency is necessary for the sustainability of any project. In September, there was a slight decrease in the compliance of the SDOH documentation because of a new guideline directing to the case managers to lead the SDOH documentation. So the challenge is that they are outnumbered and need more staff to do such documentation process, unless there is a concerted effort to ensure who is the best to lead the documentation and take the full responsibility and accountability. Such as a program will only achieve success and its goals. The stakeholders' reception. This project was well received by stakeholders as they share the same advocacy. There was a small amount of resistance with the hope that this would be focused on a critical component of the following steps to be improved. There was a formation of super users for both days and nights to serve as liaisons to assist if there were any questions. This group was given an intensive orientation to troubleshoot any issues. Information technology monitored and summarized data on who among the patients SDOH has been completed or remains incomplete. The advantage was to see the positivity that will capture if there are any issues regarding the domains of SDOH, which the provider must pick up a case manager and a social worker to highlight and prepare necessary interventions. Personnel from data analytics are more than willing to help and have volunteered their commitment to advocate for a solid program to cater to the social determinants of health, have relevant interventions, and improve collaboration even outside the hospital to involve other external stakeholders. Feedback indicated strong support for the initiative, with many stakeholders recognizing the importance of comprehensive SDOH documentation for improving patient care. Paradigm shifting is being aware of how you perceive things. So if it is an issue and you think there's the need to be a resolution, thus you plan and take action and get it. Sustainability. To ensure the project sustainability, ongoing training for healthcare providers and integrating SDOH documentation into standard EHR practices were planned. If the project was not sustainable, the one-time implementation was expected to make a difference by raising awareness and initiating improvements in documentation practices. Sustainability means to cultivate and improve referral system, build relationships with key stakeholders, engage with healthcare providers, community organizations, and social service agencies that can refer patients. Regular meetings and updates can help maintain these relationships. Leverage technology. Use EHR systems to track and manage referrals efficiently. Implementing automated referral processes can streamline communication and ensure timely follow-ups. Provide training and resources. Offer training sessions for staff and partners on the importance of SDOH and how to document them effectively. Resources and support can enhance their ability to refer patients accurately by Shen and his team in 2020. Sustainability involves networking strategies, attend industry conferences and workshops, participate in healthcare, social work, and public health events to meet potential collaborators and stay updated on best practices. Join professional associations, become a member of relevant professional organizations to access networking opportunities and resources. Engage in online communities, participate in online forums and social media groups, focus on SDOH and healthcare innovations to connect with like minded professionals. Using data to take action, health systems increasingly recognize SDOH data's importance in providing equitable care. For providing instance, UCLA Health proactively examined its equitable care efforts and improved the assignment of Z codes, which help understand the social drivers affecting patient health. The initiative led to better patient outcomes by providing more access to care. Digging deeper to find gems. A study at the University of Utah Health revealed that 40% of emergency department patients had unmet social needs. By implementing SDOH screening protocols and enhancing data capture processes, they could identify gems within patient charts indicating social risks. This allowed for more comprehensive coding and support for vulnerable populations, emphasizing the importance of sensitivity, trust, resources, and patience in addressing SDOH needs. Importance of education through conferences and professional organizations. The article underscores the value of attending conferences and joining professional organizations. Health information leaders from UCLA Health, University of Utah Health, and Northwell Health shared their experiences and insights during presentations at the AHIMA second conference. These platforms provide opportunities for learning, networking, and sharing best practices, which are crucial for advancing SDOH initiatives and improving health outcomes. Sustainability involves collaborative techniques. Establish cross-disciplinary teams, form teams that include healthcare providers, social workers, IT specialists, and community leaders to ensure a comprehensive approach to SDOH documentation. Develop collaborative projects. Initiate joint projects with community organizations and healthcare providers to address common SDOH challenges. It is necessary to share data and insights. Create platforms for sharing and insights on SDOH to foster collaborative environment and improve patient outcomes. What are the next steps after project implementation and evaluation? To ensure the sustained benefits of the project over time, our primary goal is to develop a sustainability plan. This plan will delineate the maintenance of project outcomes by identifying necessary resources, financial, human, technological, for continuous support. It will also entail the allocation of responsibilities for upholding project outcomes. Continuous improvement is essential for enhancing project processes and outcomes. Establishing a feedback loop to regularly gather data and insights and scheduling periodic reviews to assess progress make essential adjustments and foster innovation and adaptation to changing needs and circumstances are crucial steps in this regard. Furthermore, comprehensive documentation and knowledge sharing are pivotal. This involves creating detailed documentation of project processes, outcomes, and lessons learned, developing training materials and user guides, and disseminating findings and best practices through reports, presentations, and workshops. Effective stakeholder engagement is achieved by maintaining strong relationships, ensuring ongoing support, regularly updating stakeholders on the project's progress and impact, and involving them in decision-making processes. Addressing any concerns or feedback promptly is also essential. Moreover, resource allocation is vital to ensure the availability of adequate resources for ongoing project activities. This includes securing funding and budget allocations for future needs and allocating human resources to support ongoing activities. Access to necessary technology and tools should also be ensured. In addition, it is recommended to develop a detailed action plan outlining specific tasks, timeline- timelines, and responsible parties for each subsequent step, including milestones and deliverables to track progress. Establishing a monitoring and evaluation framework, defining key performance indicators or KPIs to measure the project's ongoing impact, and utilizing data analytics to monitor performance and identify areas for improvement are essential. It is crucial to foster a culture of continuous learning by encouraging team members to participate in professional development opportunities and promote a culture of feedback and continuous improvement. Furthermore, leveraging technology such as project management software to track tasks, deadlines, and progress, and implementing data management systems to facilitate easy access to project information is crucial. Engaging in networking and collaboration by joining professional organizations, attending conferences to stay updated on best practices, and collaborating with other organizations to share knowledge and resources are also recommended. Adhering to these steps and recommendations can ensure the continued success and sustainability of the project according to Swartz. Steps to becoming an expert. It is needed. There is this article by Erickson and his team in 2007 emphasizes the following steps. Identify your focus area clearly and define the specific area or aspect of the project you want to master. This will help you channel your efforts effectively. Set specific goals. Establish clear, achievable goals for learning and development. Break down your larger objectives into smaller, manageable tasks. Engage in deliberate practice. Focus on practicing tasks that challenge your abilities. Deliberate practice involves continuous improvement through feedback and refinement. Seek mentorship. Find an expert mentor in your field. Learn from their experiences. Ask for guidance and observe their methods. Continuous learning. Read books, attend workshops, and take relevant courses to stay current with the latest research trends and best practices in your field. Also, the article by Leonard highlights the following steps: network with peers, join professional organizations, attend conferences, and participate online forums. Networking can provide valuable insights and opportunities for collaboration. Reflect and adopt. Regularly reflect on your progress and adopt your strategies. Be open to feedback and willing to take changes to improve. Document your learning. Record your learning journey, including successes, challenges, and lessons. This can help you track your progress and stay motivated. Professional goals and AONL competencies, as mandated or influenced by the American Organization for Nursing Leadership. Our professional goals must focus on the enhancement of leadership skills. It is developing the ability to lead teams effectively, make strategic decisions, and inspire others. Improve improving knowledge of healthcare environments by gaining a deeper understanding of healthcare systems, policies, and the social determinants of health, developing better communication strategies, enhancing verbal and written communication skills to effectively convey information and collaborate with stakeholders. AONL competencies must be enhanced by improving, developing, and practicing effective, objective, and responsible with the communication and relationship building. This competency involves effective communication, relationship management, influencing behaviors, and building strategic alliances. Knowledge of the healthcare environment, understanding the complexities of healthcare system, including clinical practice, healthcare policy, and the impact of SDOH on patient outcomes. On leadership, demonstrating visionary leadership, ethical responsibility, and the ability to drive organizational change. These goals and competencies align with the objectives of your SDOH project to improve SDOH um, documentation in the UCSD Health EHR system, ensuring that it enhances patient outcomes and supports broader goals of security and sustainability. Lessons learned after reflective thinking. This project on improving SDOH documentation in the electronic health record system at UCSD Health provided several valuable insights, such as the importance of SDOH documentation. The project underscored the critical role of SDOH in patient care and outcomes. Proper documentation helps identify and address social factors that affect health, leading to more comprehensive and equitable care. Challenges in standardization. Implementing standardized SDOH documentation practices revealed challenges such as varying levels of staff understanding, differences in the data entry practices, and the need for consistent training and resources. For the personal and professional growth, enhanced leadership skills. Leading the project required developing strategic thinking, decision making, and team management skills. A better understanding of healthcare environment. The project provided more profound insights into the complexities of healthcare systems and the impact of SDOH on patient outcomes. Improve communication strategies. Effective communication with stakeholders, team members, and the patients was crucial for the project's success, leading to the improved communication skills. And this was by Shen et al. Thank you for listening. This is Jas Pahimola, and I encourage each one of you to advocate for the promotion of health justice, equity, diversity, and inclusion. SDOH is the key to holistic, safe, and quality patient care. If you have any questions, you could reach me through this email address, and that's my number.